got dry mouth, have you ever woken up with a sensation of your tongue being stuck to the roof of your mouth? Or are you like mid sentence, right? And then you have to take a gulp of water because your mouth is so dry. It's very common in people who have autoimmune diseases, people who are on certain medications, and mature people. Notice I use the word mature, I didn't use old, okay? So, my name is Dr. Arinola Dada. I'm a rheumatologist. I help people with autoimmune diseases and joint pain become pain free and get their immune system back on track so that they can live active lives. Okay, so I am here to tell you 5 things that you must do to improve your mouth and reduce the dry mouth sensation. Hi, Dr. Neka. So, 5 things we're going to talk about those right now, like I promised. Okay, one, water. Okay, so water and fluids that have low in sugar. The number one function of saliva is that it has antibacterial properties, and so having decrease in saliva means that bacteria can multiply real quickly. So we really want to avoid sugary food. So if you're going to drink fluids, we want you to drink a lot of water, and we also want to make sure that you're drinking fluids that are low in sugar. So next thing is gum, but sugar-free gum. Like I just talked about how too much sugar is a problem, especially when you don't have that saliva running through your mouth and protecting your teeth with its antibacterial properties. So that's number two. So sugar-free gum, right? And then there are over-the-counter substitutes. There is xylitol and there is biotin. Those things actually are saliva substitutes, okay? And then, strange thing, breathe through your nose, not your mouth. And if you're a snorer, that could be a problem. So do talk to your doctor about that. And then actually adding moisture to the room that you sleep in. So having a humidifier actually will help to improve your saliva and also just reduce that dryness. But more importantly, let's talk about the things that you actually have to avoid. So I think we all know this by now. Avoid caffeine, avoid tobacco, right? And because those things actually increase the deterioration of your dentition, right? And then, strangely enough, right, if you have a cold, right, you're using a decongestant, well, guess what? It's reducing that saliva, and is reducing basically all the fluids in the nasal passage as well as the oral passages. So antihistamines and decongestants are notorious for causing dryness in the eyes and mouth, right? And so, and we already talked about sugary foods, but I can't talk about it enough because the more sugary foods you eat, uh, so, what are the things that you must do proactively? Brush your teeth. Fluoride is your friend, okay? So, seeing your dentist at least twice a year if you have dry mouth. There are actually things that they can give you. There are prescription strength fluoride gels and tooth gels that can be helpful. There's also a fluoride rinse that can be helpful. So, my name is Dr. Arinola Dada. If you are in the greater Seattle area, contact us at overlakearthritis.com. If you think this video has been helpful, like it, share it, and I'm wishing you all a healthy, happy 2023. Thank you, guys.